Let's know about integrated patho and medicine topics. Hematology, very high yield. Anemia approach, microcytic, macrocytic, hemolytic, iron deficiency versus thalassemia versus anemia of chronic disease, megaloblastic anemia, B12 versus folate deficiency, hemolytic anemias, AIHA, G6PD, HS, SCD, pancytopenia and aplastic anemia, leukemias, AML versus ALL versus CML versus CAE. Myeloproliferative disorders, CML, polycythemia vera, essential thrombocythemia. Multiple myeloma and plasma cell dyscrasias. Lymphomas, Hodgkin versus non-Hodgkin. Bleeding disorders, hemophilia, VWD, DIC. Thrombophilia, factor V Leiden, protein C, S. Cardiovascular system. Acute coronary syndrome. Atherosclerosis and risk factors. Heart failure, HFrEF versus HFpEF. Rheumatic heart disease, infective endocarditis. Cardiomyopathies, DCM, HCM, RCM. Hypertension, primary versus secondary causes. Valvular heart diseases. Pericarditis and cardiac tamponade. Respiratory system. Pneumonia CAP versus HAP, lobar versus bronchopneumonia, tuberculosis, pathogenesis plus complications. Bronchial asthma, pathology of airway remodeling, COPD, emphysema versus chronic bronchitis. Interstitial lung diseases, ARDS. Lung carcinoma, small cell versus non-small cell, pulmonary embolism, pleural effusion, transudate versus exudate. GI and liver. Peptic ulcer disease, H. Pylori pathology, malabsorption syndromes, inflammatory bowel disease, UC versus Crohn's, cirrhosis and portal hypertension, viral hepatitis, acute versus chronic, fatty liver disease, NAFLD, NASH, hepatocellular carcinoma, pancreatitis, acute versus chronic, GI bleeding approach. Endocrinology. DM type 1 and 2, DKA versus HHS, thyroid disorders, thyroid nodules and carcinoma, adrenal disorders. Pheochromocytoma, pituitary adenoma. Calcium metabolism, osteoporosis. Renal system. Acute kidney injury, pre-renal, renal, post-renal chronic kidney disease, glomerulonephritis, nephritic versus nephrotic, diabetic nephropathy, hypertensive nephrosclerosis, renal tubular acidosis, pyelonephritis, renal stones, dialysis complications. Oncology. Hallmarks of cancer. Tumor markers, paraneoplastic syndromes. Chemotherapy adverse effects. Solid tumors, lung, breast, colon, liver. Central nervous system. Stroke, ischemic versus hemorrhagic. Meningitis and encephalitis. Seizure disorders. Brain tumors. Demyelinating diseases, Parkinson disease, Alzheimer disease, myasthenia gravis. GBS. Infectious diseases. Sepsis and septic shock. HIV, pathology plus opportunistic infections. Opportunistic fungal infections. Malaria, dengue, typhoid, COVID related complications, still asked conceptually. Fever of unknown origin. Thank you.